At the end of this video, you will have a better understanding of the relationship between you and the university in the first few years as faculty, and review the times in your career that you will be interacting with the DAC. Thus far, you have all been admitted to an anesthesia department with a practice plan. You have been granted hospital privileges at a Tasman hospital, and you have an appointment in the University Faculty of Medicine within our department. All of these appointments and requirements are interconnected and must be maintained as part of your ongoing clinical and academic work. The relationship between you and the university is what I will be highlighting in the rest of this presentation. When you were appointed with a category, rank, and academic position description. We're going to break these down now. Your category is either full-time or part-time, and it depends on the nature of your hospital's affiliation with the university. It also depends on the amount of time you spend in clinical academic work supporting the mission of the university. At greater than 80% of your professional time, that will put you in the full-time category, and 20 to 80% of your professional time in the part-time category. There are also adjunct and visiting categories, which we won't be talking about today. You are also appointed with an initial academic rank. This rank was determined based on your prior scholarly achievements at the time of your initial application. The university sets out strict standards. Over the course of your academic career, ranks progress, as diagrammed here. If you hold a full-time category, rank promotion is expected but not required. If you hold a part-time, then rank promotion is possible but not expected. We will be discussing lecturer to assistant promotion later in this presentation. Finally, you will have an academic position description, which will guide your activities in supporting the academic mission of the university. These descriptions are university department specific, and here are the ones that we have at our department. In assigning clinicians to academic position descriptions, we set out the expectations of academic work and help guide the scheduling of your time that is spent in different academic activities. The academic portion of your time within your APD is further broken down into different categories: clinical activity and related teaching, formal teaching, research activities, and administrative activities. The time adds up within all the categories and should equal the amount of time spent in academic work. As a clinician teacher, the majority of time is expected to be scheduled into clinical activity and its related teaching, but it doesn't mean that you do only that. Your contributions in other realms are important and should be documented within your CV, CPA dossier, and teaching dossier as appropriate. During a person's career, one might change categories as interests and expertise develops, and this change can be made with the discussion and approval of the site chief and chair of the department, along with the one who holds the description, and that's you. A further breakdown and some examples of kinds of academic activities are found in this chart, which is spread over 2 slides for easier reading. Distributing the work of the academic mission means that no one person within a department is responsible for any one type of academic activity. Contributing to the breadth of the academic mission is encouraged and then recognized. And overall, the benefit to you is to structure your academic work to achieve the high promotion standards of the university. We will now look at other times you'll be interacting with us at the DAC. You are at the beginning of your academic career at U of T, and your appointment is currently a probationary one. At the 3-year mark, when invited by the department, you will support an application to convert to continuing appointment. An overall letter, your MOU, a CV, CPA dossier, and teaching dossier, along with a site chief letter outlining your academic contributions, will be reviewed by the DAC. The review focuses on the scholarly and academic activities you've accomplished in your first 3 years and ensure that they've aligned with the expectations of the APD for you, the faculty. I have recently heard that there is some angst amongst the new faculty that a 3-year review is a bar that is difficult to achieve. I want to assure you that by working towards your MOU, meeting with your chief to ensure progress, the vast majority will change to continuing annual appointment. Extending the probationary period to fill in any deficits is not a negative outcome of this review. And if you are working within the department and contributing to the academic mission, but missing some of your APD requirements, but filling another appropriate APD, our recommendation may be to switch to a better fit. Termination recommendation is almost unheard of and would be reserved to those with irremediable deficits or significant professionalism problems. Once a 3-year review probation has passed and you have been converted to continuing appointments, then you have certain rights as clinical faculty and defenders at the university of your rights. Rights include freedom of academic investigation, publication, scholarship, and additionally to grieve or undergo dispute resolution between you as a faculty member and the university itself. There are also benefits for us as full-time faculty with academic appointments. There is a scholarship program for your dependents for their first undergraduate degree to receive a tuition scholarship equivalent to 50% of a U of T arts and science degree. And in 2021, that amounts to just over $3,000 per year. This is transferable to other universities through reciprocal faculty agreements. Faculty additionally has special rates to athletic facilities and the faculty club. And as faculty, many university courses can be taken with a tuition waiver. The other thing that you might be doing in front of the DAC in your future is to apply from lecturer to assistant professor. This application can be triggered whenever the criteria are met. It is not a timeline restricted application. And the focus of the assessment and the requirements for proof is that your scholarly activity has been shown to have significant impact at the local level. An additional pathway to promotion, and the one that I myself went through in 2011, is through a sustained contribution to the academic mission. Once you are at the rank of assistant professor, then further advancement of rank is through a much more regimented process, and a separate university department committee is set up to help guide you as an applicant. I would like for you to keep our small but mighty committee in mind when you are considering how you can contribute to the academic mission on the admin side. The members of our committee are our colleagues from TAS and hospitals. We meet 4 times per year and are supported by the academic coordinator of the department. I find it really wonderful to read about the depth and breadth of what my colleagues are doing across the city. When you hear of the need for new members on our committee, please consider joining us. So what should you do next? How can you best prepare yourself to meet the requirements of your 3-year review? What I suggest you do is that you keep your CV, teaching dossier, and CPA dossier up to date. There are templates available for all of these. These are required at all reviews. Your MOU is a joint agreement at your initial setup. Work towards it. Know what % of your academic time you should be engaging in the different categories and choose the activities that best fulfill your MOU. There can be a tendency to pile work on, but don't let that happen to you at the detriment of your MOU completion. A mentor within your department or even at a different site can help you to decide which activities are best to devote your limited time and energy. Be reflective and responsive to constructive feedback. Avail yourself of continuing education available to you. You will have your own learning curve as you begin your academic career. How to become an effective teacher. This is in parallel to our dynamic and demanding work environment and patient care. You are a valued colleague, and we want the success to come to you. Online resources that outline the standards and procedures that I discussed are found here. And we will now pause for questions. Thank you for your commitment to advancing the science and knowledge of anesthesiology by joining us here in the Department of Anesthesiology and Pain Medicine, Temerity Faculty of Medicine at the University of Toronto. I look forward to our further interactions as your career takes off. Be well.